Hello, today we'll discuss the detection, prevention, and prophylaxis of a meningitis study. Introduction. What is meningitis? Meningitis is an inflammation of protective membrane that covers the brain and spinal cord. This inflammation can be caused by bacterium, fungus, or viral infection. Once infected with disease, it can be spread to other individuals by coughing, sneezing, and close contact. Symptoms of a patient that's infected with meningitis can include headache, stiffness of the neck, vomiting, and fever. These symptoms are aligned with many other illnesses that can be the cause of before mentioned symptoms. To make a proper diagnosis of meningitis, it's highly recommended that a brain image via CT of the head is taken before escalating to obtaining a sample of cerebrospinal fluid, CSF, through lumbar puncture. CSF is currently considered the most precise method of obtaining an accurate diagnosis of meningitis. The prevention of meningitis is paramount in healthcare systems due to the severity of this disease affecting the immunocompromised patient population as well as the associated comorbidities that are known to cause complications to the patient's overall recovery. Due to the known issues of this disease, healthcare providers are known to proactively treat for this disease when associated symptoms are mentioned: headache, stiffness of the neck, vomiting, fever. This proactive course of action in many cases exposes patients to harsh medications that is not required. The plan of action also raises risk and probability of patient experiencing inadvertently harmful reactions to the treatment, which can cause harm to the patient. The purpose of this research is to examine the current plan of action that is in effect for healthcare professionals and to determine whether an update of the clinical decision support systems should be updated or reconfigured to include a better plan of action for patients that are displaying meningitis symptoms. A usability study was conducted to determine whether a current CDSS system required changes. This study's focus was also on antimicrobial stewardship, which is the overall foundation of the proposed research. It was found that although CDSS systems overall improved the appropriate use of antibiotics, there were usability errors that caused providers to choose the incorrect antibiotic which was given to the patient. These errors were categorized by the severity 1 through 4, with 1 being a minor cosmetic issue to 4 being fatal. In many of these cases, even some causes when no error occurred, the patient received the wrong antibiotic. It was found that most of the errors occurred during the translational phase of the CDSS system. Perhaps this is due to the fact that many of the symptoms that are used for input can code for many different diseases. An antimicrobial resistance study addressed concerns of antibiotic misuse and potential risks involved in the misuse of antibiotics. This study explores the benefit of an antimicrobial stewardship program. This program's focus is to improve antimicrobial prescribing, which will in turn benefit improving the unnecessary antibiotic utilization within a healthcare organization. This study is included in research to explore the option of all healthcare organizations adopting this practice, but most importantly, having this group review all order sets and workflows involved with meningitis diagnosis to the associated risking that can be the result of antibiotic misuse. The study most importantly addresses the diagnosis of meningitis can be improved by using a rapid multiplex polymerase chain reaction panel, PCR, to confirm that the patient has been exposed to meningitis before providing treatment. Currently, there is an ongoing issue in healthcare on the treatment of meningitis. Due to the rapid spread of infection, it is treated without obtaining lab results. This diagnosis is made prematurely, and in many cases, it is the treatment given to patients that do not have meningitis. The goal of this research is to find a better option of how to treat patients that have meningitis. In order to find information on this subject, patient providers will be the study subjects that will receive an open-ended format structured web-administered questionnaire. The questionnaire will be closed format due to time restrictions. The questions will be given to the subjects with the focus of keeping question function factors in mind. These factors include the length of the question, the number of the responses, the format of the question. The font size will be Calibri, as it is considered easy to read. The size of the font will be 14 because it's recognized that some providers can be considered elderly. To alleviate the risk of satisficing, the questions will be optimized on an interval basis. The questions presented will help give an overall view of what is the current status of the institution. It will also give a better explanation of the current measures in place to ensure that the patient is given the best care the institution can provide. It has been proven that teaching hospitals follow the best practices within healthcare fields compared to all institutions of the world. In other literature, it is considered that a distinction between a teaching hospital and a teaching university should be made. For the sake of keeping the beginning of this succinct, the distinction will not be made for this questionnaire. It is important to consider if a medication is available on override, because if this is the case, the current safety measures that are in place should not be considered due to the fact that the provider still has access to antibiotics. It's important to know whether the override function is monitored for antibiotics or if it should just be narcotics only. Meningitis is the topic of study for this research. It's very important to know whether there is a current order set in place for meningitis, as this may assist the user in making the proper decisions for which antibiotic should be given, as well as a test or symptoms should be associated with the medication prescribed. The overall purpose of these questions is to provide more information on why the current issue exists. Perhaps this is a simple awareness issue. It is known that organizations have more staff than others. The questionnaire can be used to verify certain jobs are essential to the healthcare organization. This includes infectious disease specialists, pharmacists, microbiologists, and lastly, antimicrobial committees. Ethical issues. All patients have had their personal information removed from the utilized research and given unique identifiers. This research will be utilized from past actions and tested rigorously in a testing environment before transitioning to a production atmosphere. The risk experienced by the patients will be minimal. There is no conflict of interest, and this will be presented to the University Internal Review Board. Overall, the proposed research study is important to the healthcare community and will ultimately improve the current state of care within hospitals. This research will contribute to the intended audience by confirming the proper steps to improve a clinical decision support system. Due to the multiple healthcare professionals that utilize the computerized order entry system, it has been found that usability of CDS systems should be reassessed for errors that are currently within the system. These errors are cosmetic as well as translational. All errors should be reviewed and approved by an antibacterial stewardship team. It was also found that an antimicrobial stewardship team should be incorporated within all practices. This team can review current ways of treating patients, provide improvements when necessary. In this particular case, the diagnosis of patients can be made by completing a rapid PCR before prescribing a prophylaxis prematurely. Overall, the research has the potential to lower patient risk of unnecessary antimicrobial exposure, lower hospital costs, reduce patient stay, lower rate of antimicrobial resistance. In closing, to resolve this issue, after utilizing the information obtained from the proposed questions, the order sets from the electronic health records can be analyzed for admission orders. It can be questioned what triggers the test for meningitis. A future research topic that can be done that will contribute to this research is the timing of the lab results. In the hospital, lab results are key to diagnosing a disease. There may be a way to have a broader lab test to obtain the initial results for the patient. Due to lowering the risk of harm that can occur to the patient as well as lowering the cost to the institution and the rate of hospital-acquired infections, this research is a perfect candidate for a grant.